anything that can affect a person's hearing will first affect the delicate hair cells. They're technically called outer hair cells. And the reason why it's so important to complete a thorough diagnostic assessment, which includes the otoacoustic emissions test, is to document the status of those outer hair cells. They are the very first link in hearing once the sound gets, into the inner ear. And research shows that almost everybody with tinnitus of any type, whether it's bothersome or just occasional, will have some difficulty or some problems with those outer hair cells. They're very, very delicate, and if they're not functioning perfectly normally, a person might hear tinnitus. So the very first step is to evaluate the hair cells. Now, how could the hair cells possibly be damaged or not be working properly? Well, noise exposure is a really common explanation. And there may be others. There are sometimes diseases or pathologies that might affect the hair cells, and then the person's healthy again, but they still have the hair cell problems. When I counsel patients who've been told there's nothing wrong with you, and you have normal hearing, there's nothing wrong with your hearing system, patients find it very comforting, the patients with bothersome tinnitus, to actually be told, well, that wasn't entirely correct. When we performed this very sensitive measure of these delicate hair cells, we did see a little problem. There's nothing to worry about, but that's where the tinnitus is coming. That's the tinnitus that you're hearing in your brain really was first generated by the malfunctioning or abnormally functioning outer hair cells. So, and that's concrete. It's something that the person can really latch on to as an explanation for why they have this tinnitus. And then the management, of course, can be much more effective.
What generally causes tinnitus in your experience, and what do people need to know about this important issue?
Sure. Well, as I mentioned earlier, tinnitus can be it is a symptom, and it can be a symptom of ear disease, or, as I said, some more systemic diseases or disorders like high blood pressure, for example, or high cholesterol. But let's say the person doesn't have any of those problems. They're generally healthy. Tinnitus isn't by itself ringing in the ears or buzzing, cricket sound, any kind of sound in the ears is really not an abnormal thing. Most people, if you put them in a very, very quiet place, sometimes even children, even young adults with perfectly normal hearing sensitivity, they'll still hear some sounds. And I very often tell patients I hear high-pitched tinnitus, and when we started talking, Ben, I didn't hear it. Now I hear it very loudly because my whole focus is on tinnitus. But tinnitus itself is not dangerous. It shouldn't really be of any concern. What happens with many people is a very, very common scenario, is they have some tinnitus occasionally. Maybe when they're going to sleep at night they hear it, maybe after they go to a concert or they've been around loud noise, even driving down a highway at high speed. After that, they hear a little tinnitus, and then they don't pay any more attention to it. And then something stressful occurs in their life. It could be the loss of a job, a death in a family, any bad news. Could be just that they're working a little more, or perhaps they're very, very tired for some reason, and now they notice the tinnitus, and and it's consistent, and they didn't really notice it before, so they assume something different has happened. But it's sort of a subclinical tinnitus, a tinnitus that was already there that's now become very, very noticeable. And if I can identify that stressful event, and we can track it down and say, hey, so the person will say, well, no, actually, now that you mention it, I did occasionally hear tinnitus, never bothered me, but it was after that stressful event, and they identify the time frame. Then we know, well, stress is a factor, but they know this is not something new. It's not something they really, really need to be concerned about. We just need to address the stress and put this tinnitus that they were hearing in the past back to that role or that level for them. So tinnitus by itself is not an unusual phenomenon. Most people in a quiet location will hear tinnitus. It's when it becomes, a real problem for someone and they can't ignore it that we have to address the tinnitus.
One of my biggest, inspirations of meeting you and becoming your colleague and your friend here is your dedication and confidence to our patients. I've heard you say, "I will not give up until I solve this." Could you explain more about where that confidence comes from?
Yes, well, first I'll say that many healthcare professionals, sadly, when they encounter a person with bothersome tinnitus, don't take that attitude. They basically brush them off. Surgeons often do this because they can't cut the tinnitus out. They can't operate on it. There aren't many medications that are beneficial for bothersome tinnitus, and so my confidence comes from knowledge. Knowledge is power. That's something I try to convey to patients in my counseling. We know, fortunately, and we have for about the last 20 years, so we know quite a bit about tinnitus. There was a time when I didn't have this confidence because we really didn't know what was causing tinnitus, what were the underlying mechanisms. But now we do. And my confidence also comes from seeing many thousands of patients with varying degrees of bothersome tinnitus. So it's the confidence is based on its solid foundation. It's not just to make the patient feel better. The patient with bothersome tinnitus has to trust the person who's trying to help them. They have to have total confidence in the person. And very often, what I'll do is just very quickly give them a little bit about my background. Often, a physician who is referring them to me has already done that. In fact, they've said very positive things about me, which helps as I begin to develop trust and develop my relationship with the patient. And that's a key word. I want to make sure this person knows that I'm going to do everything I can to help them, that I have the skills and the knowledge to help them, and I will tell them point blank. I'll look them in the eye right at the very beginning and say, "Now that you've come to see me, you're my patient, and I will do everything I can to make sure we get this tinnitus to the point where it doesn't bother you. And I'm confident we can achieve that goal."